everybody, in this video I'm going to talk a bit about the term disorder and how that relates to illness or disease. How are these terms used in medicine and psychiatry, and are they equivalent, are they synonymous, or are they distinctive, and do they set apart disorders as somehow lesser than intrinsic illness? So, I've got several references that I will put in the description here, but let me just share what I put together here. Clinically, there was an old terminology used, organic versus functional. In this case, organic referred to a medically measurable or identifiable anatomical or structural abnormality. Functional was a term used to describe a manifestation of symptoms or symptom complex that could not be identified by current diagnostic methods. That terminology has been abandoned. Now the terms primary and secondary are used, and that is to indicate whether the illness originates in a certain organ or if it is from some other cause. So, describing all of that now, let's talk about the definition of organic mental disorders. During the past few decades, the advent of newer pharmacological treatments and advances in fields such as neuroimaging, genetics, and molecular biology have resulted in a growing recognition of brain pathology as the basis for mental disorders. Indeed, the introduction of the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, the DSM-4-TR, which is put out by the American Psychiatric Association for diagnostic criteria, description of certain pathologies in psychiatry. This amendment was done in 2000. This text agrees that the term mental disorder, unfortunately, implies a distinction between mental disorders and physical disorders. That is a reductionist anachronism of mind-body dualism, and admits that the term mental disorder persists in the title of the manual because an appropriate substitute has not been found. In other words, the terms are synonymous. A lot of lay people have misinterpreted disorder as somehow inferior to, less serious than, less significant, or valid, or genuinely pathological than something that's physically present and more socially accepted as a genuine illness. This is a false notion. Disorders are very much legitimate illnesses. Or diseases, if you prefer. Those words are also interchangeable. There's been a lot of discussion about what causes an eating disorder like anorexia to develop. Is it just the media? No, actually. There are 3 different components of eating disorder development, in this case anorexia. Let's see here. Physiological, that's like genetics. We do know that a family history of eating disorders makes the manifestation more likely. Also, new research published online in the journal, International Journal of Eating Disorders, explains why this happens. For the study, scientists administered a one-time dose of the drug amphetamine, which is a stimulant, and causes the release of dopamine in the brain. Positron emission tomography, PET, which is a type of scan, was then used to visualize the subsequent dopamine activity. So they get like a chart where they can actually measure it. peaks and troughs, different levels and responses. In helping subjects without an eating disorder, the amphetamine-induced release of dopamine was associated with feelings of extreme pleasure in the brain's reward center. There are different areas of the brain, and in different kinds of brain scans, different neuronal activity, like say you're recalling something, your memory center would light up on certain scans. So that's what they're talking about evaluating. When they administered the amphetamine, these are the areas of the brain that were stimulated and could be seen. The non-eating disorder population given the amphetamine felt pleasure in the brain's reward center. However, the people with anorexia, amphetamine made them feel anxious and activated the part of the brain that worries about consequences. So here's like an actual physiological response or etiology that is not dismissed by just some kind of behavioral influence. Okay, so let's see, Walter K., MD, Professor of Psychiatry and the Director of the Eating Disorder Treatment and Research Program at the University of California, San Diego School of Medicine, was the head researcher, and he said, this is the first study to demonstrate a biological reason why individuals with anorexia nervosa have a paradoxical response to food. The third issue, after the second issue, the second issue is psychological. Personality type, low self-esteem. Anorexia nervosa is associated with certain personality traits such as perfectionism, obsessiveness, and withdrawal, as well as other psychological disorders such as anxiety, depression, and obsessive-compulsive disorder. Focusing on food and weight provides a diversion from underlying psychological problems that may be too difficult to address or control. In other words, it's a coping mechanism. It's toxic and aberrant and dangerous, but it is a mode of survival when one cannot cope any other way. Okay, so the third is behavioral, a history of trauma or loss, negative or toxic family influences, and yes, media and social influence. It is a component, it is a potential trigger, but it is not the whole story. Best descriptor I've ever encountered for describing how anorexia and related EDs develop is the loaded gun triad. It's an analogy that says genetics are the gun, personality traits are the bullets, and some environmental trigger, a trauma, a loss, a negative family dynamic, fire that gun. So there's a lot of complexity to the development of eating disorders, and it is not as simple as wanting to be thin or pretty. These are genuine diseases. So yeah, eating disorders are very serious mental illnesses. In fact, anorexia nervosa is the most fatal of any mental illness. 20% of us will die from this disorder, despite treatment interventions and desire to recover. So that's important to acknowledge. Also, recovery is not as simple as picking up the fork. In fact, even when anorexics were weight restored and outwardly physically normal, at a normal weight, the mental aspects of the disorder remain for life, and many physical consequences will remain for life. So, those of us suffering with EDs need to strive to find a workable balance between sickness and health. to minimize the damaging and detrimental sequelae that come with such a disease and maximize wellness.